Hi, I'm Alistair Kenworthy from the Ministry of Health. I'm here with Dr. Tony Smith, who's just addressed the SNOMED Expo in Wellington, and we've had a very entertaining presentation from you. Thank you very much for explaining how you've introduced an electronic system into an area where there was none before. I'm just going to ask you, what were the change management issues that were the most difficult for you in introducing this new technology?
There were lots, and it's hard to choose the most difficult. I know, for example, for our IT guys, there was some really big stuff, but because I was quite removed from that, I was able to see them fix all those issues. But I know that behind the scenes there were hundreds and hundreds and hundreds of hours by our IT team. From a clinical point of view, the biggest change issue was the change for our staff. And it was dealing with over 3,500 staff, some of whom are volunteers, with a paper system that was firmly embedded into our culture and saying we're not going to be using paper and we're going to be using electronic. And that took making sure that our staff were on side, getting their involvement and their feedback so that they felt part of the process. And now it's firmly embedded in everything we do.
And I think you made the comment that if they don't like the system, they'll make it not work, which exactly. I thought was very perceptive.
Yeah, exactly.
I'm just wondering, with the better information that you're obviously capturing with the SNOMED data, have you gained any insights from that? Have you had a chance to do big data on it?
Not yet. So we've only been up and really running now for about 6 months, and it's a little bit too early. We certainly had the ability to be able to look at subsets of data quickly and easily, for example in specific conditions, that would have taken us hours and hours and hours of work trolling through paper forms in the past, but we haven't yet taken a total look at all of the data.
But you will be doing that?
We will be, noting that the data, there is so much data that you have to kind of choose what it is that you want to look at.
Ambulance is a very fast-paced environment. Often we're challenged that you can't introduce electronic systems into those environments like that because the clinician doesn't actually have time to interact with the system as well as the patient. Have you suffered any? Can you see patients and give them the attention that you did before, or is there some compromise?
There's always some compromise. So clearly, if you're, for example, resuscitating a patient in cardiac arrest, you haven't got the time to be recording what you're doing at the same time that you're doing it. But that was the same with our paper system as well. So there are many things which are recorded after they've been done, but the electronic system prompts you to remember things in a way that were easily forgotten when you were doing paper. So for example, if you record the blood pressure but don't record the time, the system will ping up and say, hold on a sec, you haven't recorded the time, whereas on paper it might have been written down with no time, and then subsequently later no one ever filled it in. So it can't always be done at exactly the same time, but we've actually found it's easier in many ways to do it, particularly when it's just touchscreen, electronically than it is to write on a piece of paper. And our staff have adapted to it very well.
You've got presumably a wish list of enhancements to the application.
We have.
Which is your top wish list item around information, capturing information?
There'd be two. One is the information going into the DHBs electronically and us no longer having to print it off and give it to them. And the second would be being able to access the electronic information, particularly discharge summaries and GP summaries, electronically. So our staff at the scene could pull up the patient and go, we can see that when their GP last saw them, they had X, Y, and Z, or we can see that they've been into ED 5 times in the last 4 weeks with the same clinical problem.
I've just got one last question for you. When you embarked on this IT adventure, did you realise that you'd be rolling out possibly the first national level SNOMED implementation in the world?
No, we did not, but I'm very pleased to hear that.
Thank you. Thanks,
Thank
Dr.
you.
Smith.